Dementia is a group of disorders that affect the brain, causing a decline in cognitive abilities such as memory, language, and problem-solving skills. Today's video we're going to talk about the etiology, the classification, the symptoms, diagnosis, and the treatment of dementia. Now, the exact cause of dementia is not known, but it's thought to be related to abnormal protein deposits in the brain, which can damage nerve cells and disrupt communication between them. Certain factors may increase the risk of developing dementia, including age, family history of the disorder, and certain lifestyle factors such as smoking, high blood pressure, and high cholesterol. Dementia can be classified into several types, including Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. Each type of dementia is characterized by a specific pattern of symptoms and underlying brain changes. So the first type, Alzheimer's disease, this is the most common type of dementia, accounting for around 60 to 80% of all cases. Alzheimer's disease is characterized by abnormal protein deposits in the brain, including beta amyloid plaques and tau tangles, which can damage nerve cells and disrupt communications between them. The exact cause of these protein deposits is not fully understood, but genetic and environmental factors may play a role. Vascular dementia is another type. This type of dementia occurs when blood flow to the brain is interrupted, often due to stroke or other vascular event. Vascular dementia is typically characterized by a sudden onset of symptoms, and the severity of symptoms can vary depending on the extent of the damage to the brain. Lewy body dementia is another type. This is characterized by abnormal protein deposits called Lewy bodies in the brain, which can cause fluctuations in cognitive function and hallucinations. It's often misdiagnosed as Parkinson's disease due to the presence of motor symptoms such as tremors. Frontotemporal dementia. This type of dementia is caused by damage to the frontal and temporal lobes of the brain, which can affect behavior, language, and decision-making skills. Frontotemporal dementia is often diagnosed at a younger age than other types of dementia and can have a more rapid onset. And mixed dementia is the last type, and as the name suggests, mixed dementia occurs when a person has more than one type of dementia. For example, someone with Alzheimer's disease may also have vascular dementia. It's important to note that some people may have more than one type of dementia, making diagnosis and treatment more complex. There's also other less common types of dementia, such as Creutzfeldt-Jakob disease, Huntington's disease, and Wernicke-Korsakoff syndrome, which are caused by specific genetic or environmental factors. The main symptoms of dementia include memory loss, difficulty with language and communication, problems with problem solving and decision making, and changes in mood and behavior. These symptoms can be progressive, worsening over time, and they can have a significant impact on a person's ability to function independently. The diagnosis of dementia typically involves a physical exam, medical history, and cognitive and neurological assessments. Imaging studies such as CT scans or MRIs may also be used to identify changes in the brain. Treatment of dementia typically involves managing the symptoms of the disorder and addressing any underlying medical conditions that may be contributing to cognitive decline. This may include medications to manage behavioral and psychological symptoms, such as agitation or depression, as well as lifestyle modifications such as regular exercise, a healthy diet, and social engagement. In some cases, cognitive rehabilitation and therapy may be recommended to help maintain cognitive function and improve quality of life. So just to conclude, dementia is a group of disorders that affect the brain and cause a decline in cognitive abilities. We can classify it into several types, each with specific patterns of symptoms and underlying brain changes. The diagnosis usually involves a physical exam, a medical history, and cognitive and neurological assessments, and the treatment can be medication, lifestyle modifications, and cognitive rehabilitation and therapy.